Hello, my name is DenYelle Kenyon, and I'm here guest hosting the Inside CRCA with the READ Corps, which stands for Research Ethics and Dissemination. And the mission of the READ Corps is to provide investigators, institutional review boards, and tribal nations with high-quality research support and to ensure compliance with federal and tribal regulatory requirements for community-linked transdisciplinary human subjects research. Welcome. Could you guys please introduce yourselves and tell us a little about yourselves?
Yeah, so I'm Michaela Seiber. I am the director of the READ Corps. I also work on the CRCA Regulatory Knowledge Corps. I've been here for about a year now. I went to USD. I got my MPH there about 2 years ago. I'm getting my PhD right now at USD, so I'm very busy, but and I'm also an enrolled member of the Dissemination.
Hi, I'm Melissa Buffalo. I'm an enrolled member of the Meskwaki Nation of Iowa and also Crow Creek and Lower Brule. I primarily work with CRCA under the Community Engagement Innovation Division, but I'm also excited to work on the READ Corps, which I think is a really good bridge between community engagement and some of the research we do in that dissemination. So, yep.
Great. Could you tell us a little bit more about the READ Corps?
Sure, I'll take this. So the READ Corps, we really have three aims that we work to do. The first of which is to help investigators with their research and navigating human subject protection, research regulations, and interacting with IRBs and tribal IRBs. The next is we work to provide training on these things for investigators or other researchers or community members involved in research. And the last aim is kind of focused on dissemination and how to engage the community and making sure that the research findings that are done in their community are translated into ways that the community will understand in culturally appropriate ways. So those are the three things that we've been doing lately.
That's wonderful work. Could you give us some examples of the types of services that READ provides?
Yep, I can kind of jump in and give an example. So just like Michaela said, kind of providing some of the tools and resources and kind of looking at the unique challenges that some of our investigators may be facing, especially with working in a tribal community for the first time. So recently I've been working with one of our new investigators who's first time working in a tribal community. So one, just trying to provide education and tools and resources with understanding a tribal community. One example that we have is our Rosebud Sioux Tribe community profile. So kind of gave her that as an example and just kind of helping her understand some of the programs on the reservation and what are some of the outlets and resources she could look to. Also had her sit through my American Indian trauma training and just kind of, again, just trying to do my best to give her an example of what the work she'll be doing in some of these tribal communities will be like.
At the beginning last year, maybe in the fall, we were really focused on helping some investigators navigate the IRB process and put together protocols, and we're helping with putting together some consents because one of our investigator has a project working with adolescents, which requires a couple extra protections, and we're thinking about the consents and assents and making sure that the adolescents know what they're actually consenting to. So we've been doing a lot of that stuff, but lately the big things have been with dissemination of research results with one of our partners, the Dissemination. They did a pregnancy health survey about 2 years ago and are really working to put out the results to their community. And so that's something Melissa and I have been really entrenched in lately, is helping them get through that survey and put out the results with pairing it with educational tips for the community and just really letting them guide how the results are put out. And we're just really a tool to make sure they're doing it effectively, but they're really making sure things are culturally appropriate from their end.
Fantastic. Can you tell us who can utilize these fantastic services?
Yeah, so right now a lot of the project leads within Sanford on the grant are able to utilize our services. That's what our main focus has been. Some of our partners through CRCA have been utilizing us. Other investigators in Sanford Research and Sanford Health we're trying to form some relationships with, so kind of a variety.
And just to add to that, I think it's exciting just as Reed is building up and again getting that experience with folks in Sanford and some of our tribal partners. I think eventually we could go outside of our 5 tribal partners and maybe look regionally and nationally, so it's kind of exciting.
Definitely room to grow in these exciting services. So how can folks get a hold of you?
Yeah, you can definitely reach out to Melissa or I, email us. You can check out the CRCAIH website. There's a spot where our core is. The Sanford Research has the Reed core, contact information. So definitely multiple ways to reach out to us.
Fantastic. Well, thank you so much for your time today, and wonderful. Thanks for joining us to learn more about this important CHOPR core, and we look forward to seeing you again in the next Inside CRCAIH.